Should be.
Good morning. My name is Rick Saladino. I know many of you in the audience, and I bet I know many of you at home. For those of you who I haven't had a chance to meet, I am one of the Associate Vice Chairs for Faculty Affairs, and I am also part of the Office for Faculty Development. The Office of Faculty Development sponsors 4 Grand Round sessions each year, and today is one of those sessions, so welcome. It is my honor and pleasure to introduce Dr. Elaine Schulte as our Grand Round speaker this morning. I first met Dr. Schulte when I joined the faculty of the Academic Pediatric Association Scholars Program called Advancing Pediatric Leaders. That was in 2020. During our earliest planning sessions, I was so impressed with Dr. Schulte's extraordinary knowledge in the arena of coaching. And since that time, I continue to be fascinated by Dr. Schulte's innate capacity to effortlessly connect with those she coaches. Now, I'll be the first to say that coaching is not easy. It's not advising. Coaching is not even mentoring in the ways that we tend to think about the activity of mentoring. Rather, coaching uses inquiry in a safe space to facilitate self-discovery and personal and professional growth. Now, that's a fairly succinct description of coaching, and we're going to learn a lot more about that this morning. As a more formal introduction, Dr. Schulte earned her Bachelor of Arts degrees in music and biochemistry from Skidmore College, a medical degree from Albany College, and a Master of Public Health degree from the University of Albany. She completed her residency in pediatrics at the Albany Medical Center and a residency in preventive medicine at the University of Albany, New York State Department of Health. Dr. Schulte spent more than a decade of her early career in Cleveland. She served as the department chair of general pediatrics at the Cleveland Clinic and co-founded the Cleveland Clinic Center for Excellence in Coaching and Mentoring in 2008. Dr. Schulte was then recruited to New York in 2017 and is professor of pediatrics at Albert Einstein College of Medicine and the vice chair of academic affairs and faculty development at the Children's Hospital at Montefiore. She is a board-certified executive physician coach and holds coaching certifications from the International Coaching Federation and the Center for Credentialing and Education. It's no surprise then that Dr. Schulte serves as a senior advisor, faculty member, and coach for the American Academy of Pediatrics, the Academic Pediatric Association, and the American Pediatric Society. And in that capacity, she's created and delivered leadership development curricula and programming related to physician coaching and mentoring. All of that certainly fits with the theme for today's presentation, but I would be remiss to not to take a moment and highlight another of Dr. Schulte's areas of expertise, that is adoption medicine. As such, Dr. Schulte has served on several related national committees, including the American Academy of Pediatrics Executive Committee of the Council on Foster Care, Adoption, and Kinship Care, and the Executive Committee of the Committee for the Pediatric Workforce. So it's my pleasure to introduce Dr. Schulte as my friend and colleague and my coach and speaker with extraordinary expertise in the domains of professional development, well-being, coaching and mentoring, and physician leadership. Today, she will deliver our Grand Rounds entitled Beyond Mentoring, the Coach Approach to Professional Fulfillment.
Well, thank you, Rick, and good morning, everyone. It's really wonderful to be here. I was reflecting with some of my new friends last night about my first time in Pittsburgh, which was probably over 30 years ago, and I gave probably my first Grand Rounds, and it was about adoption, but it was not in this beautiful facility. It was in your old hospital. So I'm very, very happy to be here and happy to meet some new friends and be able to visit with some old friends as well. So I have nothing to disclose this morning. Here we go. My only disclosure is that I'm a diehard Ohio, Cleveland sports fan. And I do need to show this here because I know there are many diehard Pittsburgh sports fans here. And, for those of us who practice pediatrics every day, it's super important that we speak the sports speak. So I hope you have fun with your patients talking about sports. I work in the Bronx now. It's really hard to be a baseball fan in the Bronx if you don't root for the Yankees. Your sports team did pretty well this year. It was pretty exciting. I can't say I was rooting for them necessarily. Browns didn't work out so well either. And we're talking about coaching and professional fulfillment today. And I hope your coach is working on his professional fulfillment. Sounds like things are going to work out favorably for him next year. So enough about Cleveland and Pittsburgh and sports. I do need to always acknowledge my dear friend and colleague when we talk about coaching, Dr. Andrea Sykon, who was a co-founder of the Center for Excellence in Coaching and Mentoring with me back in 2008. Dr. Sykon is the enterprise chair for the Department of Internal Medicine and Geriatrics at the Cleveland Clinic. And she and I have created and shared much of this content that you're going to hear today. So in the next 45 minutes or so, we're going to talk a lot about coaching. Probably won't be able to cover all these things in depth. We're going to define the academic roles of mentoring, coaching, and advising. We're going to talk about what I mean, my notion of what a coach approach to mentorship and professional fulfillment is. And then I'm going to introduce you to some very core coaching skills and ask you to consider how you might be able to use those across contexts in your work as well as perhaps outside of your work. Another person I need to mention, some of you may know Dr. Marty Leapow, and this is sort of how I got into faculty development. Dr. Leapow was a professor of pediatrics and vice chair and then chair of the Department of Pediatrics at Albany Medical College. I knew her since the time I was a medical student, and Marty was a fabulous clinician, educator, teacher, friend, and just an amazing colleague. And shortly after I finished my residency training, I went to my first professional academic meeting, and everybody at this academic meeting was talking about mentorship. You have to find a mentor. You need to get a mentor. A mentor will change your life. So I thought, okay, who's going to be my mentor? And I thought, of course, it will be Dr. Leapow. So I came back to the meeting and I went to speak with her. She said, how did it go, Elaine? And I said, I need to find a mentor, and I think you would be perfect. Would you be my mentor? And she said, you're going to have to mentor yourself. And that was not what I was expecting. And over the years, I came to realize what she was really saying was, it's on you, the individual, to create your own networks of people who are going to support you and help you throughout your career. Now, of course, she did mentor me. She was an amazing mentor, but she was really helping me understand the value of networking and the relationships that you have to develop throughout your career. And networks are so critical as you move forward. Kathy Cram describes this notion of developmental networks, and some of you might be familiar with her work. And she talks about, again, it's not just one person who's important in your life, it's many people, and they come and go over time depending on your need. And of course, it's most important that you drive that process, and you're thinking, well, when I'm early in my career, how do I know how to drive that process? Well, you don't. So this notion of inquiry and asking questions and sort of coaching yourself, with which I'll talk about a little more in a bit. But these developmental networks are really important as you go throughout your career. This was a study that was done in Harvard with a bunch of MBA students a while back, and they looked at what they called their developmental network and their density of their developmental network, meaning the tighter your developmental network is, meaning you find people who are all the same, the less likely you're going to be able to expand your notions and awareness. So thinking about finding people in your network who are extremely broad, extremely diverse, come from different parts of life and work is the best way to enhance your professional fulfillment and create your professional identity. So those of you who are early, maybe trainees or early career faculty, thinking about who is in your network, are they all the same type of people? Or have you been able to create a more diverse network as a way to enhancing your professional fulfillment? We're talking a little bit about professional fulfillment today. I'm not going to go into great detail about it. And this, as I know many of you, there are people in the audience here who are well-being experts and know this work better than I do. This is Tate Shanafelt's model from Stanford about what it means to have professional fulfillment. And it's components of all these things: organizational culture of wellness, the efficiencies of practice, and then personal resilience. And when you think about your professional fulfillment, it's not just, did I go running today? Did I have time for meditation? It encompasses all these things when you think about how you stay professionally well. And in any organization, this ideal culture of well-being, what does that mean? It means, again, I'm going to talk about relationships a lot and how important they are, and your relationships with each other, with your patients, with your colleagues. And when you share common missions and values with your organization and each other, is really how we're all going to stay well as we work and as we grow. So back to the developmental networks today, and just thinking about what are we going to talk about. I'm going to very briefly define these roles of advisor, coach, and mentor, and then we'll think a little bit further about how we might be able to use a coach approach when we're doing any of these things. I think we're all pretty familiar with what an advisor is, so I'm not going to spend a lot of time. You probably had advisors in medical school. You might use advisors in your residency training. Advisors are people who provide advice. They provide feedback. They help you think and use the data around your performance in terms of how you can improve. And this is my definition of coaching. Actually, it's not my definition. It's the International Coaching Federation's definition of what a coach is. And I'm sure many of you have had coaches. Some of you might be coaches, and we probably have very different definitions of what we think a coach is. So for the purpose of today, we're going to use the ICF definition, which is a coach is a thinking partner, somebody who supports an individual in a thought-provoking and creative process to inspire them to maximize their professional and personal potential. For those of you who like pictures, pediatricians, we like pictures and cartoons. I like to think about a coach as somebody who helps you remove the blinders, who helps you think about things and see things differently than you currently do. A coach holds up a mirror and uses the skill of reflecting and reframing to help you feel and think and process what's going on for you in a different way. And as Dr. Saladino already pointed out, in the purest definition, a coach does not tell you anything. It's all about your own awareness. In academic medicine, there's many different models of coaching. I understand there's some coaching that's happening in your medical school. And this is a nice table that was designed by Linda Love and University of Nebraska, thinking about how coaching is used across academic health centers. So there's academic coaching, traditionally what happens in medical schools. This, to me, sounds more like an advisory role, although there sometimes is focus on wellness and professional identity formation, using those skills of inquiry. And then there's skills coaching or performance-based coaching, and sometimes that looks like, I need help with communication at the bedside. Could you come and watch me? Or I need help in the operating room figuring out how to do this procedure slightly differently. I need some coaching around that. And then there's this notion of developmental coaching, and that's the type of coaching that I'm primarily talking about, where you're working with a coach who's helping you see new things, new ways, new paths for you to explore as you go on your professional journey. And then there's this little category at the end called at risk, or what we used to call remedial coaching. And I think for many of us in academic medical centers over the years, the original notion of coaching was when you got sent to coaching because you were having a problem. That kind of work still exists. Although in this culture of well-being and professional fulfillment, I like to think about coaching as an add-in, as a supplement, as a way to augment your journey forward, not looking backward at problems or challenges that you might be having. There's emerging data about how coaching can be impactful for professional fulfillment for physicians. And I'll tell you, which is probably not a surprise, people think of coaching as a soft skill. And the impact of coaching is pretty hard to measure. And there's lots, as you know, lots of different ways that we measure professional fulfillment, well-being, engagement, burnout, resilience. And I just share some of the recent data from two different studies. One back in 2019, Lottie Derby, when she was at Mayo, used a randomized controlled trial of one professional coach coaching 88 physicians over a period of time, and then surveyed them about the impact of coaching and measured all sorts of things, including burnout, quality of life, resilience, et cetera. So some suggestion that coaching was beneficial. The challenge with these studies is the coaching intervention is for a period of time and then it stops. This more recent study from Carrie Palmer in Boston looked at women's surgery trainees, and women's surgeons received some training in coaching, and then they coached the trainees just for 3 sessions over a period of about 9 months. And the trainees who received the intervention reported significant improvement in their professional fulfillment, et cetera. So we believe coaching is impactful. At Montefiore, at the Children's Hospital, we run a peer mentoring program. I'll tell you, I went there asked to run a coaching program, and I convened a group of people, started the work, and I said, we're going to run a coaching program. And they said, we don't need coaching here. This is academic institution, Elaine. We need a mentorship program. So he said, okay, we'll call it a mentoring program, but we're going to use faculty coaching, and I'm going to teach all of you to use coaching skills, and I'm going to ask that you use these in the group. So this has been going on for over 5 years now, and we run peer groups consisting of early career faculty, a faculty coach, and a faculty mentor. And the groups are made based on the mentoring areas of interest. So research, publication, manuscript production, work-life integration, time management. I ask the early career faculty, what do you want? What kind of mentorship do you want? We train everybody to use coaching skills, and then they meet on a regular basis over the course of 1 academic year. And we ask them at the end of the year whether they want to continue in the program or not. After 5 years, we have original 5 groups, they're still meeting. So that we know they're getting something out of it. This is what a typical group might look like. So I put the mentees together based on common areas of where they want mentorship. I find a faculty mentor who's an expert, and in this group, I happen to serve as a coach. So I'm not a researcher. I don't know anything about research, but I know a lot more now, having listened to these conversations. All of these early career faculty entered the program seeking independent funding, and all 3 of them have K awards currently. So we're very proud of them. I described the outcomes of, here we go, sorry, a self-report, what's happening in these mentoring programs, and you can read some of the anecdotes. We asked the mentees to describe the impact. How has this helped you? How many articles have you published? How many grants have you received? How many awards, et cetera? And you can see the numbers. They had about 100% response rate from both the mentees as well as the coaches and the mentors. And what's really interesting, the coaches and mentors who are full professors noted an increase in their academic productivity as a result of participating in this program. Almost everybody noted that they felt more engaged with people outside of their division, speaking to that relationship, developmental relationship network piece. Almost everybody reported using coaching skills inside as well as outside their meetings. So we're really proud of this program. So speaking of mentoring, let's just define that as you know it. Traditional mentoring is somebody, as a mentor, is somebody that transfers their knowledge or their expertise to somebody else in order to enhance their understanding. And a mentor typically is presenting from their own perspective, their own values, and their own experience. You're going to say, well, that Matt Tomlin's the coach. Well, sure, he's a coach, but he's really mentoring, right? He's presenting what he thinks is the best thing to do based on his knowledge and his expertise. He's not asking Mason Rudolph a coaching question, particularly in the heat of a game. Maybe he might be asking coaching questions later. So thinking about mentoring for a second, I want you to think about your mentoring relationships, either as a mentor or as a mentee. And just think for a second, folks who are at home, if you want to type in the chat, just somewhere with what are the best qualities of those relationships that you've had? Some of the best qualities. I'm looking for the chat up here. Oh, I see. Okay. Let's see if anybody chats in. Well, while you're chatting, thinking, I'm going to share with you what we would consider some of the best qualities of relationship-centered communication, of mentoring relationships. The relationship is mutual. There's some notion of confidentiality. When you're mentoring somebody, you're setting an agenda. Hopefully it's a shared agenda about the expectations in the relationship. There's value and respect in a mentoring relationship. Hopefully there's empathy, a lot of curiosity, some respectful honesty and listening. And guess what? These are coaching competencies. So you're using all these things in your best mentoring relationships. So back to Marty and Dr. Leapow, when I asked her, would you be my mentor? I was really hoping that she was going to tell me everything, and she wasn't going to tell me anything. She wanted our relationship to be mutual. She wanted me to go out and find my own relationships and share some of myself with other people. So as you think about mentoring and using coaching skills, just remember it's a reciprocal, it's a back and forth. It's not just a one way. So sort of to further distill the difference between traditional mentoring and a coach approach, let's just remember again what a traditional approach looks like. Someone telling somebody else what to do. And guess what? We're doctors and scientists. We love to tell people what to do, right? Let me ask you, how often do you like to be told what to do? Doctors and scientists usually don't like to be told what to do. So it puts us in an interesting position, right? So let's think about somebody you might know named Dr. Rising Star. Dr. Star is an early career faculty member who comes to you for mentorship. They're looking at academic promotion criteria and think that they need some sort of leadership position to strengthen their application, but they don't know how to find one. They have some experience in medical education, and they're also interested in studying vaccine hesitancy, but they're not sure how to get started. They're also about to go on a parental leave, so they don't know whether to hold off or to move forward. You're mentoring Dr. Star. What might you say? I'm sure you have some ideas in your head about what you might say. You might say anything that comes to your mind that's based on your experience, your values, and what you think is most important for Dr. Star. You might say, that's crazy. Don't do anything until you come back from parental leave. Or, I know exactly who you should talk to. Let me introduce you to Dr. Famous. So what might be the limitations of using a traditional approach to mentorship? And maybe some of you have been in this position where you've gone to ask for advice and someone starts telling you what to do. It's surface, it's tactical. I want this, okay, then do this, without exploring what's most important. What are your true goals? What are you really hoping to achieve? There's some unmet expectations when there's not further dialogue. Maybe in this example, the mentor's overlooking the emotion. Dr. Star sounds very overwhelmed, right? Lots of things, lots of balls in the air. We all bring bias to relationships. And as a coach, I work really hard to remove my bias, and that is a challenge for anybody. And then sitting in the mentee role, and someone tells you what to do, how much pressure do you feel to go out and do exactly what they say? You know, if there's a hierarchy, you feel a lot of pressure to go do what they say, even if you don't want to do it. And on the flip, if you're mentoring someone and they come to you, you're the expert, how much pressure do you feel to have the right answer? A lot sometimes. And then when there's just a lot of back and forth at a surface level, what's the likelihood that Dr. Star is actually going to follow through with what you tell them to do? So without diving deeply into understanding what's going on for Dr. Star, it's going to be really hard for Dr. Star to move forward and have that awareness. And thinking about your why is what's made Simon Sinek quite famous. He's one of the most popular TED Talk people around, and he's written a couple books about starting with your why. And he defines this golden circle that people often don't think about their why. We don't think about our why most of the time, unless you're in a coaching relationship where somebody really helps you explore what's most important to you. And for those of us who've gone through traditional medical training, right, way back in high school or before that, I want to be a doctor. I want to be a doctor. Okay, so what do I do and how do I do it? What do I do? How do I do it? You pause at medical school interview and you have to explain your why a little bit, but you get through medical school and then you go to residency and then you maybe train as a fellow, and it's all about the what and the how, the what and the how. And we forget about what's most important to us. Why'd you get up this morning? Why'd you come and sit here? What was most important to you? So when we're using coaching skills, we're really helping people get at their why. And instead of telling people what to do in a traditional mentoring approach, using a coach approach, you start with helping others get at their why. So that could sound like, well, what does an academic promotion mean to you? I do academic affairs in New York, and people come to me all the time. I want to get promoted. I want to get promoted. And then you start asking them about the promotion and how is it important to you? I get dozens of different answers. So asking open-ended, inquiry-based questions, and this is the tricky part because the information is not for my knowledge. Asking these open-ended questions is really to raise awareness in the other. Those of you in leadership roles, I'm sure people come to you and they say, I want a leadership position. Everybody wants a leadership position. Well, how's the position important to you? What do you know about a leadership position? How would your life be different if you had a leadership position? In other words, like, what are you thinking? What are you thinking? Right? So using these open-ended inquiry-based approaches helps ensure that Dr. Starr will own the exploration, own the solutions, and be more motivated to move forward. So some more impactful questions to get at their why. There's hundreds of coaching questions that you can use. And as you're looking at these questions, you're thinking, wow, doctors don't talk like this. We don't talk like this. This is not what we're trained to do. This is not the way our brains work. We're deficit-based thinkers. We want to think about the problem. We want the details of the problem. When did it start? How long has it lasted? What did you do to alleviate it? Have you ever had this problem? Those are doctor questions. These are coaching questions. And you're going to say to me, well, this isn't mentoring. This doesn't sound like mentoring, right? Well, what might be the benefit as you think about this to using a coach approach in your mentoring relationships? There actually is some neuroscience around coaching. Dr. Richard Boyatzis from Case Western Reserve is one of the leaders in exploring the neuroscience of coaching. And he describes a coaching process that he just talks about using intentional change theory. So coaching is really about helping people change or get unstuck. And he applied 2 different coaching interventions and studied this with graduate students, and then stuck them in an imaging device and looked at what was happening in their brains. And the first intervention was called the positive emotional attractor intervention of coaching. So using coaching skills, asking these students about the future, about possibility, about what they could imagine. And then the other coaching condition was what he called the negative emotional attractor, where the coaching was focused on, tell me about the problem. What's going on? Why isn't working? What have you tried that's worked? Nothing. Okay, well, why hasn't it worked? That's coaching to the negative emotional attractor. And so you can see, for those of you who are imaging experts, which I am not, the differences in where the brain's lighting up, whether you're using a positive emotional attractor approach to coaching or this negative deficit-based questioning. And guess what? The students who received the positive intervention were much more willing and able to be reflective, listen to feedback, accept feedback, and have a greater idea and passions around exploring their goals. What exactly is happening when you're coaching to the PEA? You're lighting up all kinds of regions in your brain where you're able to imagine things and think creatively. You're able to be motivated. And guess what? You calm down. It triggers your parasympathetic response. It also supposedly activates this area in your brain that's called the default mode network, which triggers your desire to connect with other people, form social relationships, that affinity response to stress that some of you might be familiar with. It puts you in a much better mindset to think about what's possible versus when you're coaching to the negative, talking about the problem. How do you feel when somebody starts talking about problems? We get agitated, right? It stimulates our sympathetic response. We get stressed, our heart rate goes up, our blood pressure goes up. And guess what? We like that, right? Because we're doctors and scientists. But it's not good for us. And it's not good when you're trying to support somebody else in their own personal growth. And this is just a table that describes the various characteristics and what happens when you coach to the positive emotional attractor versus the negative emotional attractor. And again, when you're coaching to the negative, asking about the problem, it's not helpful. And what we want to inspire you to do is try to use some of these positive emotional attractor coaching types approaches to help people move towards their dreams. And as I already said, our challenge is in healthcare, people bring us problems every day, whether you're listening to your patients who are bringing you problems or you lead a team and they bring you your problems. People bring us problems every day. We like to fix problems. We're problem fixers. But when we focus predominantly on negative concerns and problems, it's actually not helpful. So if you think about Dr. Starr for a minute, Dr. Starr could bring you all these problems. And just think about anybody in your life or in your work who comes to you and brings you a problem. I don't know what to do. The students don't like me. I can't get started. I don't have enough information. I don't know this well enough. Nobody supports me. I'm stressed. Nobody helps me. We hear these things all day long. How do you actually feel when someone brings you a problem like this? If I were to poll you when we were doing a workshop and I was going to ask you to sort of reflect on this, you'd say, many of you would say, I like to fix problems. I want to help people, right? Some of you would say, it's exhausting. Some of you would say, I know I'm supposed to, but sometimes I don't know what to do. I don't know what to say. I feel sorry for people. So we get this response all the time, and we know it's hard. It puts a lot of extra stress on us as people who are helpers. So if we were to reframe these problems with a question, somebody brings you this problem, I have no idea what to do. Your knee jerk is to tell them what to do. And we just talked about why that sometimes is not such a good idea. If you would reframe that with a question, simple question, what's most important right now? Oh, okay. How about this one? Nobody ever listens to me. What would being heard mean to you? I can't get started. Well, what if you could? What would it look like? What would be happening? These are coaching questions. I don't know enough. You know, we talk about imposter syndrome a lot. And oftentimes people say, I just don't know anything. I've heard that from colleagues like yourself. I don't know anything. Really? You don't know anything? Of course, you know a ton of things. What do you know? What's interesting to you about vaccine hesitancy? What if you did know more? What would it look like? I have no support. I have no help. What does it look like? What would it feel like? How would you know if support was happening? Describe the type of help you'd like. And now you're thinking, well, that's ridiculous because everybody needs more help. Everybody wants more resources. Everybody wants more time. True, true, true. And it's not that you're not going to talk about a problem eventually. It's helping people get in a mindset where they can be open to possibility. Okay? So using these questions is going to help light up others' brains in the way that will be most helpful for them to move forward. I like to use the notion of an artichoke rather than an onion. And when you're asking these questions, you're just peeling the layers back to help them really get at what's most important to them. The middle of an onion's not so exciting. The middle of an artichoke is like amazing, right? It's like the best thing in the world. So if you get to the heart of the artichoke, you can have all kinds of possibilities as a person. And then just thinking about this again, because I think I know what many of you might be thinking. Well, this is like kind of silly, like, so what? Well, it's not that you're not going to talk about the problem. You want to start with supporting someone so they fully understand their why and what's most important to them, and helping them clarify their goals and their motivations and their values. And when you do that, you're going to build a lot more rapport and trust with that person, which is going to help them be even more vulnerable and more open to exploring possibilities for change. And then you can start talking about the challenge, the problem, the support. Then you bring your expertise. That's why they came to you. And you can offer your suggestions and advice. And at that point, people will be able to better see a way forward. They may not walk away with an answer. They still might be a little dissatisfied, but I believe they're going to be much farther along on the path to discovering what it is actually they want and how to get there. So using a coach approach when you're mentoring is really about asking first and then telling. And then you're going to say to me, well, how do you know how much you have to ask before you tell? And that's why you have to take coaching courses, because it's hard. It's really, really hard. So let's go back to Dr. Starr for a second. So laundry list of questions that you can ask. And again, there's many, 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 many. And in coaching school, the shorter, the more general the question, the better question it is. Here's the other challenge for us. We like to talk, and we don't like to wait. And giving somebody your undivided attention might be the best gift you can ever give anyone. Think about how you give your patients undivided attention. Not so good. We usually interrupt within 8 seconds. But I bet you interrupt less fast with your patients than you might do with your colleagues or maybe in your personal life. So this is another great takeaway that I want you to consider. The best gift you can give to anybody is your undivided attention. How do you give people your undivided attention? Think about a patient encounter. Think about when you lead a team and you're waiting for feedback. One of the most important things you can do is set the intention for the conversation. What are you really hoping here? I see patients in the Bronx. It's a tough place to work. Every time I go into exam room, I grab the handle on the door and I set my intention for what I want to get out of that encounter. Sometimes I don't know what I'm walking into, and that's okay. But I set the intention so I can be fully present with those folks. Remove as many distractions as possible. Our world is full of distractions now. And if you really want to give somebody your undivided attention and be with them, it's important to get rid of the distractions. Coaching competency 101, open, curious, and flexible. And I will tell you, physicians and scientists are generally not very open, not very curious, and we're very inflexible people. So this is really, really hard. This is a new skill for many of us. And I would invite you to practice just one of those skills at a time and not try to be all these great things at once. And then try to ask these powerful questions that are helping the individual to reflect on their own goals, their own values, and their own motivations. And now you're probably thinking to yourself, well, what if their goals are wrong? What if their motivations are not aligned with my division's motivations? Or what if their values aren't aligned with the organizational values? This is where you have to remain open, flexible, and curious. And you may never have complete value alignment. You may not understand somebody's motivations. And in a role as a coach, it may not be that important that you understand. You're there to support and provide openness to help the individual find their way forward in the purest of coaching questions. So what happens after the why? In a coaching conversation, when you've helped someone explore what's most important to them and they sound like they're crystal clear, then it's time to think about, okay, what's next? How are you going to move forward? Or let's dig a little more into this challenge that you're having. And you might ask questions that sound like this. Well, what have you tried so far that worked? How can you build off your success? Something else that we talk about in coaching is listening for people's strengths. You can apply this strategy in any conversation that you have. We don't walk around with our strengths written on our forehead. So if you're trying to support somebody, you're listening to their story and you're going to reflect back the strength in their story. Oh my gosh, I can't believe you were so, persistent. You have great tenacity. When was the last time someone told you that? Right? We don't talk like that. But particularly if you're working with a trainee or an early career person, they could use a little confidence building, and calling out someone's strengths is a great way to help get them in that sort of growth mindset about what possibility thinking could happen. What else could you consider? That's a great idea. What else could you consider? Using that question, what else? How else? It's a very powerful question. Oftentimes, we always think we know exactly what it is that we want to do. And then someone challenges, well, what else could that look like? What else could that look like? What else could that look like? And the first idea is not often the best, right? Your first thought is not often the most impactful. So asking somebody what else 3 times can be amazingly supportive. I never thought of that. Thanks for that idea. People say that to me all the time. Thanks for that idea. Wasn't my idea, it was your idea. So then in this exploratory phase, individuals have many, many, many different options. Wow. Which of these might lead to a breakthrough? Oh, that's really exciting what you're telling me now. And again, it's not that you're not going to talk about the problems. You've just helped somebody get in a completely different mindset. Yes, there are problems. There are stumbling blocks. What might pop up? What are your thoughts now about how you could move forward or get over those barriers? And then who else can help you? This is another stumbling block for people in medicine. We forget that we have people who can help us. We like to do everything ourselves. And most of the time we're pretty good at it, except when we get stuck and we don't know how to ask for help. And guess what? We're helpers. We love to help people. So what keeps you from asking other people to help? So this is a very powerful question. And again, when you're working with someone using these coaching skills, this is a little bit of a vulnerable question. So you wouldn't throw this out right away. Wow, I never thought about that. Who could help me? Well, maybe that person. Who do you think should help me? Then they'll fire that back at you. I don't know. Who's helped you in the past? Who do you find helpful in the department? What does help look like? What kind of help are you looking for? Peeling back those layers to get at what might really be motivating for somebody. You have these amazing skills already. What other resources might you need? What other skills could be helpful as you explore this new leadership position? And again, you're going to say, well, they don't know. That's why they're coming to me. And that's fine. See what they say. And then you can tell them. I think in my experience, it might be most helpful if you were to take this X, Y, and Z course or read X, Y, and Z book or publication. And then after you do all this exploration, it's time to narrow down and really help that individual be accountable to what you've discussed. And you can use this skill in any kind of conversation you have with your colleagues or with your trainees. If you're giving a feedback conversation, what's most important right now that we've talked about? What's like ringing out in your brain? Or sometimes I just say, where are you right now? Wow, I never really thought about it like this before. That's really speaking to me. Okay, so what first steps will you take? When might you do it? Who else can help you? And see what they say. And 9 times out of 10, in my experience, I think I know what they're going to say, and I'm usually wrong. And I remind people, we are not in the heads of the person you're talking to. And unless you ask, you're not going to know, and they might not even know. And that's the most important part. When they identify the first step that they want to take, they're much more likely to follow through with that first step rather than you telling them, I think the first step for you would be to do this. Now your pushback to me is going to be, well, what if they say the wrong thing? What if their first step is ridiculous? What if it's going to get them in trouble? Then they'll learn. Those of you who are parents and teach parenting skills, what would you say to a parent, right? Sometimes our kids have to struggle in order to learn and experience and move forward. Now, of course, if it's something that's life-threatening or possibly career-threatening, of course you want to speak up. And it doesn't sound like, I don't think that's a good idea. I think the best thing for you to do is this. You might ask a question like, how might this not work? Let's just pause for a second. What are your thoughts about that? Well, I don't know. May I offer my suggestion? Here's my experience with a situation like this. You might consider trying this. So you definitely want to provide your advice based on your experience at this point. And then once the individual is committed to what they're going to do and how they're going to move forward, the most important part for you providing these skills and for the other person is to think about the conversation. And it might sound like, how'd we do today? What are you taking away? What could I have done better to help you? What was missing in our conversation? Asking the individual to provide some feedback. That's that mutual back and forth, that reciprocal relationship. I value you, you value me. There's mutual respect here. I always like to ask people what was most helpful. And again, I don't know. I don't know what somebody's going to say. And they might not even know until you ask the question, what was most helpful here? And oftentimes people just say, it's just been really helpful to think out loud and I have some more clarity. And guess what? That's because you provided your undivided attention to that individual. The follow-up question. This is where you have a great conversation, somebody has a great idea, and then you never see them again, right? So this is an accountability question. When would you like to follow up? Not, would you like to follow up? Oh, sure. No, when would you like to follow up? Oh, this is great. I'll come back next week. Wow, you just told me that you were going to do X, Y, and Z. How long do you think that might take? Oh gosh, it'll take a couple of weeks. How about a month? Great. When would you like to follow up in a month? How would you like to schedule that? You can help them stay accountable by putting the onus on them. Depending on the relationship and the hierarchy, you might have to help them a little bit, but you sort of have to tease that out. So I've thrown out a lot of ideas and concepts today, and I would really like you to think about, if you can send a note in the chat for those of you who are listening at home, what's one new thing that you've heard that you might actually walk away with and think about either implementing or just giving it some more consideration? Let's see if anybody has anything in the chat. And while they're doing that, my takeaways, hopefully your takeaways, are relationships are reciprocal, bidirectional, mutual, respectful. Think about how you might be able to apply some coaching skills in your current role or roles. Coach to the PEA, try not to ask about the problem too much. It's so hard for us. At least start by asking about what's important to someone before you dig into their problem, and ask first and then tell last. So thanks for your attention this morning, and I would be more than happy to have a conversation